Hello, my name is Karina Haber. I'm a third-year resident at OBGYN in Danbury Hospital. I've been an integral part of the development of our global health track. I am co-founder of MOGA, Mulago Obstetrics and Gynecology Affiliation, and am the president of Camp Mulago, our surgical teaching initiative at the National Referral Hospital in Uganda. The name of my presentation is Gynecological Surgery to the Nth Power, Exponential Training in Gynecological Surgery at Mulago Hospital, Uganda. The shortage of physicians in Africa has been well documented. Africa bears 25% of the global burden of disease with only 2% of the global health workforce. In the obstetrics and gynecology ward at Mulago Hospital, over 8,000 emergency surgical procedures are performed annually, overwhelming the handful of obstetrical residents and few responsible attendings. The majority of acute surgical emergencies are performed by a solo, unsupervised resident. On the other hand, the hospital requires that an attending is present for elective procedures, so very few of these are done. Residents get little exposure to complex gynecological procedures for benign conditions. Resources are in short supply. Therefore, the majority of women suffering from chronic disease are left untreated. Our solution is to improve surgical skill with the goal of capacity building. We desire to help train residents to be leaders in their healthcare system. Thus, MOGA was formed with the intention of enhancing services provided to the women of Uganda. The Western Connecticut Health Network, Danbury Hospital, and the University of Vermont have formed a collaboration in order to create a sustainable partnership with the leading medical school in East Africa, Makerere University, and the largest national referral hospital in Uganda, Mulago Hospital. This mutually beneficial relationship will give providers from the U.S. the opportunity to commit selfless acts of service and care for those less privileged, while at the same time enhance the education and supervision of Ugandan residents. By combining the delivery of surplus surgical equipment and organizing training camps for resident physicians, our goal is to improve the efficiency and complexity of gynecological surgeries performed at Mulago Hospital. This will give the leaders of Uganda the ability to train the next generation of OBGYN residents. While many organizations worldwide contribute to the Mulago OBGYN ward, a sustainable program focused on supervising Ugandan residents in order to provide surgical capacity building does not exist. This concept was successfully demonstrated by Duke University Neurosurgical Department. They showed that by twinning the delivery of surgical equipment and training camps, capacity building can be accomplished and maintained, providing the ultimate result of improved patient outcome. We will perform a longitudinal study that compares the types of procedures performed, morbidity associated with the procedures, and overall patient outcome during 2 years prior to the initiation of our camp, 2 years during our camp, and for the 2 years following our camp. Our first surgical teaching camp is scheduled June 1st through 12th, 2013. We have applied to a dozen organizations which focus on providing donated medical supplies and equipment to international surgical missions. We've been accepted to the AmeriCares program, who supply small amounts of basic operating room supplies such as spinal needles, IVs, and urinary catheters. Project Cure, an organization that ships containers containing approximately $450,000 worth of medical equipment, has offered to do a site assessment of Mulago Hospital to gain a better understanding of their needs. We have made small steps in terms of raising money for our mission. We have a private donor who will supply the basic needs of our first camp. We are in the process of constructing a website titled Camp Mulago that will describe our program and have a Donate Now button. We also have gained access to a grant database and are in the process of writing various grant proposals. My question to the audience are, 1, in terms of funding, what is the most efficient way to receive funding? 2, is it worth the time and energy to attempt to involve the Ugandan government in our efforts? And 3, who does the majority of your grant writing? And secondly, how do you motivate a Ugandan attending to collaborate with our efforts? There's a lot that needs to be done in terms of patient recruitment, surgical camp organization, and data entry. Should we plan on incorporating some of our funding to pay a Ugandan collaborator? Together, we can create health. An improved lifestyle for all is our goal. well-trained doctors on both sides of the Atlantic, as well as alleviation of preventable suffering. Thank you.